We know from the last few years of neurological research that when we engage, and Professor Tony Jack of Case Western has a recently published article talking about these opposing domains in the brain and how antagonistic they are. We know that when people focus on a problem, when they get involved in analytics, when they're worried about technical issues, when they get flashed in front of them financials, all of those things activate the task-positive network, a subset of the executive function, predominantly in the prefrontal cortex, but in other parts of the brain. We also know that when people are activated in the default mode network, and in particular those parts of the default mode from the limbic system all out to the posterior cingulate cortex, that's when a person is open to new ideas. That's the neural network activated when a person is open to other people and emotions and moral concerns, by the way, not just moralizing like good, bad, but the issue of is it fair? What Tony showed, as others have over the past maybe 8 years of neuroscience research, is that these two networks have almost no overlap. There's a little bit. But what he found very clearly, which has been written about by a few others, but he was able to document on a fairly large sample size, is that when you activate the task-positive network, you suppress the social network part of the default mode network, and vice versa. So when we kick off a meeting in a hospital, even a staff meeting or an administrator's meeting with financials, realize that you're making sure people aren't noticing that there are other humans in the room. Because it's not that people are being insensitive, they don't see them. And this is what often happens when a physician or a nurse gets carried away with the technical aspects in their interaction with a patient. Now, you want the doctor or the nurse to be very thoughtful about the diagnosis, about the treatment, about other interaction effects, all the things that make you great at what you're doing. So you want the task-positive network, but you need to appreciate that when you're engaged in that, your attention is shifted away from the people. And what the people and these other parts of the default mode network allow us to do is to be open to new ideas. So if something is not working within your frame of the differential diagnosis, you may not pick it up if you're staying committed to one particular way of looking at things. Likewise, you may not pick up issues that are going on in the other person's life or their demeanor, or ways you might reach out and help them in a way that might activate and help engage their immune system in a more constructive way. So these opposing domains become very important on 3 different levels. First, they are key in your interaction with the other doctors, nurses, and staff in the hospital. Because if you talk to everybody about the task-positive network, everybody's in the task-positive network. And by the way, there is an increasing amount of evidence suggesting that more often than not, this stimulates the sympathetic nervous system. As such, as you all know, we, with annoying amounts of that every day and the heavy load of it, we go into forms of cognitive and emotional and perceptual impairment. We limit our focus. But if you also start, but if you start with focusing on the person, on the patient, on the human stories of the people you've helped, even in your staff meetings, you will actually stimulate more of the social default mode network. And that will help open other people up. So in your staff relationships, you are more likely to engage parts of the parasympathetic nervous system with the default mode. And that's when, in your interactions with other staff, other doctors, other nurses, other administrative support people, that you're going to have the best ability to build these resonant relationships. So that's going to lead to people feeling more excited and doing their jobs better, with more juice, with more excitement. But it's also going to have an effect on the patients, because when you interact in this same way, where you're able to go back and forth, and we suspect that the most effective executives are cycling back and forth in less than a second. Even in patient interactions, cycling back and forth becomes very important, because that's when you can enhance the resonant relationship with the patient. And to the extent possible, help the patient help themselves and help you. That was the second. The third aspect of this, it has to do with your sustainability. It would not be surprising to make the observation that you're under a lot of stress. And that stress, annoying chronic stress with occasional doses of acute, brings you down. And in fact, fatigues you in a way which is very profound over time. So the challenge that most healthcare professionals face is, how do we maintain our sustainability? How do we rejuvenate, rebuild, renew, refresh? Now, for those of you who have studied this, you know going into the parasympathetic nervous system periodically will help. And there are all sorts of techniques to do that. Some of them are more mindfulness related, meditating, yoga, tai chi, exercise. Others are more interpersonal, caring, compassion, hope, even playfulness. But it's very hard for somebody to engage those modes, again, unless they have the underlying capability, which we call the emotional and social intelligence competencies. So the challenge that you have as a physician or healthcare leader is, how do you provide the organizational adaptability and the atmosphere in the organization that people want to bring their game, they want to do their best, and the interactions with the patients are really engaging, and you're tending to your own sustainability. This is a tall order. This is a horrendous challenge in times of uncertainty. But that's exactly when you need it the most, because the uncertainty is going to bring you down, as you well know, unless you're able to create a different atmosphere. Now, one thing that you have to be careful of in healthcare is the exercise of compassion, which is one of the strongest stimulants to the parasympathetic nervous system, can also become, what's been noted, especially in studies of nursing care, is it becomes compassion fatigue. So again, the dilemma is, because you're in such a noble profession and you want to do your all for the patients, it can easily transcend what you need to do to keep yourself feeling up, feeling inflated enough to feel excited about tomorrow. Those are the complex challenges of leadership. And in particular, they're all amplified in today's environment in healthcare.